Does your child still suck his thumb? Let's get into why it's bad and how to correct it. Hello everybody, I'm Dr. Vidisha and Pradhan and I'm an orthodontist. First of all, it's a very common finding for a toddler to suck his or her thumb. But this habit should stop by the age of 3 to 4 years. And in most cases, it does. Continuing this habit beyond 3 to 4 years, firstly, it's socially unacceptable, and secondly, it leads to a lot of dental problems. Try sucking your thumb. I mean it seriously. Try putting your thumb in your mouth and try sucking it. What exactly do you feel? You feel an inward pressure on your teeth. So imagine your child sucking his or her thumb for hours and hours, for weeks and for months. Imagine the kind of pressure it will put on the developing teeth and the developing jaws. So what happens here is that developing teeth and the developing jaws, because of this inward or suction kind of pressure, they get pushed inside. So this creates a very narrow arch and something called as crossbite, as you can see in this picture. The second thing you would notice when you place your thumb in your mouth is that the thumb rests between your upper and the lower front teeth. So again, there is a pressure application on the upper and the lower teeth, and these teeth do not come in contact. This is called an anterior open bite. All these dental problems, when you wish to correct them later, will take around 2 to 3 years of your braces time. So why let your child get into such problems and why give them such a lengthy treatment? So let's get into how to avoid thumb sucking or how to encourage your child to stop the thumb sucking habit. Number 1. Slow and steady wins the race. As this habit has been with your child for a few months or a few years, it will definitely not disappear overnight. So be patient with your child and be positive. Number 2, keep their hands busy. Boredom is one of the reasons why your child resorts to thumb sucking. When you know you are going for a long car ride or for a long dental or medical appointment, make sure you carry something that your child loves to play with. One of your child's favorite toys, a pop toy, or something like a fidget spinner. So the mind as well as the hand, they are both occupied. Number 3, praise. Every time you find your child making an effort to not suck on their thumb, make sure you verbally praise them. There is absolutely nothing like positive reinforcement at this early age. When you praise your child verbally, they feel comforted and accepted for making such efforts, and they will wish to do it more often. Number 4, rewards. Give your child a calendar and a pack of stickers. Every day that your child goes without sucking a thumb, you give them a sticker to stick on their calendar. I'm very sure initially it will be a very slow thing for you and you might start losing your patience. In the initial days, it might probably be 1 sticker or 2 stickers a week, but I can guarantee you that it will progress well for you. Number 5, teach them ways to cope. Your child can be in stress or in anxiety due to change of city, change of schools, due to birth of a new sibling, or if the parents are very busy and they fail to give enough attention to the child. These factors can act as stressors and your child might want to resort to something that's more soothing to them, and one of these soothing habits is a thumb sucking habit. So firstly, make sure you give enough affection and enough attention to your child so that he does not have to resort to such soothing habits. Secondly, teach them ways to relax, like playing in a park, coloring, music, dancing, or any kind of sporting activities. Number 6, physical intervention. So when a child is about to fall asleep or when the child is about to doze off, you can put something like mittens, socks or gloves on your child's hand. Now when the child is about to fall asleep and by habit they start to place their thumb or finger in the mouth, these materials will basically remind them that they are not supposed to do this habit. Another physical intervention that can work is something called as thumb guard. Now these thumb guards are basically plastic splints that are fabricated over the thumb, and these splints again act as a reminder when the thumb is placed inside the mouth. Thumb splints might fail in cases where your child stops sucking the thumb and instead of that starts sucking the fingers that are adjacent to the thumb. Number 7, never scold your child. As already mentioned, thumb sucking is known as a soothing habit. That is, the child resorts to habit of thumb or finger sucking when they feel stress or anxiety. And once the parent scolds them, this stress or this anxiety increases furthermore. So instead of stopping the habit, what the child basically does is he hides the habit from you. So when you are not around, the child will eventually resort to thumb sucking. What you have to do is be your child's friend, explain it to them with love and affection that stopping this habit is a teamwork and you both are on the same team. And lastly, a dental visit. If none of these have worked for you, please do not give up. Definitely consult and visit a dentist. Now, a periodontist and an orthodontist are specialists who are trained in fabricating devices which have something called as spikes or cribs on it. And these cribs are placed inside the patient's mouth. As soon as the child puts his or her thumb inside the mouth, these cribs or these spikes will act as a reminder and the child has to move his thumb outside the mouth as he or she cannot place their thumb completely inside the mouth. So these are the 8 things that we discussed on how to help your child stop the habit of thumb or finger sucking. If you have any further questions or any further queries, do message me in the comment section or you can also contact me on my Instagram page. Thank you.